Today we'll discuss regarding the compression fracture of the spine. So we have to understand whenever there is a trivial trauma or there is a fall from a height or there is some motor vehicle accident and patient suffers with a spine fracture, mainly the vertebral compression fractures, then what should be done? So vertebral compression fractures, as you can see here in the MRI, so this is the normal vertebra, this is the normal square vertebra, but here you can see the vertebral height is less, it is decreased, and in the coronal section we can appreciate the because of the fracture there is hyperintensity in the MRI because this fracture there is a fracture into the spine. So what happens once there is a fracture into the spine? Patient complains of lot of pain. He cannot sit, he cannot stand, he cannot take the weight on the spine, and because of that patient is quite crippled. So what should be done? So first thing is patient should be given proper bed rest. Patient should be given Taylor's brace so that we can avoid further complications of kyphosis. So the next step is once we start the proper treatment and assess what is the real cause of the compression fracture. Is it the osteoporosis of the spine or is it the trauma of the spine? What is the real cause of the spine of the vertebral compression fracture? We have to identify that part and accordingly we have to treat. It may require to do the MRI, it may require to do it BMD test, and once we do all the tests, we assess each and everything, we should start with the medical management. We have to start the medicines. So after 3 weeks to 4 weeks there is a good option available in which we can put cement into the spine. So to give cement into the spine, there are multiple options are available. One is vertebroplasty. Simplest procedure is percutaneous vertebroplasty, in which through the bipedicular approach we put our Jamshidi needle into the spine and put the cement into it. And once we put the cement, because of the exothermic reaction of the cement into the vertebral body, it gives good relief into the pain and it maintains the height of the spine. It further prevents the kyphosis of the spine. And another surgery in this problem is the when we do is balloon kyphoplasty. In this balloon kyphoplasty, what we do through the bipedicular approach, we put the balloon inside and inflate it, and we monitor the pressure of the balloon through the manometers. And once the balloon is inflated, it preserves, it maintains the height of the vertebral body. Then we remove the balloon and put the cement inside. That is called balloon kyphoplasty. Now there is a new procedure has come which is called stentoplasty. In this, through the bipedicular approach, again we put the Jamshidi inside and we put a stent inside the vertebral body. We inflate the stent so that the vertebral height can be restored, and into this stent we put our cement to so that vertebra can get the strength. So these are the three most common procedures that we do, and the aim is to relieve the pain of the back, number one. Number two is to prevent the future kyphosis. If we prevent the future kyphosis, patient will be much happier and better, and it will resolve its chronic back pain. More so important, it will further prevent in going the spine into the kyphosis. So here is our patient. Patient came to me in after acute trauma, and patient had vertebral compression.
क्या दिक्कत है आपको?
बैकबोन में प्रॉब्लम आई है और सर में
चल नहीं पाते हैं? अभी
नहीं
आप चल सकेंगे? थोड़ा सा भी चल सकेंगे अभी?
चल सकेंगे।
चलने में प्रॉब्लम है?
2-4 कदम बस चल पाते हैं।
कब से प्रॉब्लम है आप?
24 दिन हो गए।
कहाँ से हैं आप?
मैं गोमती नगर से हूँ।
गोमती नगर से।
जी।
So we waited for 3 weeks and patient still had a lot of back pain. Then we did the vertebroplasty, percutaneous vertebroplasty, and patient is much happier and better now. So let's hear and discuss this issue with the patient. Yes, ma'am. आप जब आप हमारे पास एडमिट हुए थे सेंट जोसेफ हॉस्पिटल में, तो आपकी कैसी हालत थी, आपको क्या तकलीफ थी?
बहुत पेन हो रहा था
कहाँ पे?
और बैकबोन में।
हाँ।
और बिल्कुल बर्दाश्त के काबिल नहीं था।
हम्म।
करवट लेने में पहले बहुत पेन था, अब तो करवट लेने में बिल्कुल पेन नहीं है और
So,
मैं सेल्फ चल लेती हूँ।
हाँ, आफ्टर 3 वीक्स हमने जो प्रोसीजर किया,
जी।
आपको उसमें कैसा लगा, आपका क्या एक्सपीरियंस रहा उसमें?
बेटर रहा।
क्या किया आपको, क्या कुछ एनेस्थीसिया दिया था हमने क्या आपको?
लोकल एनेस्थीसिया शायद दिया था,
Yes.
पूरे सेंस में थी।
यस। अभी ऑपरेशन के बाद आपको क्या फर्क लगा, कैसे हैं आप?
डॉक्टर साहब मैं बेटर हूँ,
करवट आप ले
करवट
सकते हैं?
लेती हूँ बिल्कुल, सब कुछ कर लेती हूँ।
पहले और अब में कितना फर्क आया?
बहुत फर्क है,
जी।
बहुत।
वेरी गुड, वेरी गुड।
जी।
तो आप खुश हैं नहीं है?
खुश हूँ।